The effects of an activity profile on the osteoporotic condition. Did you know that fractures from osteoporosis are more common than heart attack, stroke, and breast cancer combined? The purpose of our study is to measure the prevalence of the osteoporotic condition in retired postmenopausal women between the ages of 55 and 65 to determine the effects of past activity profiles on current bone density. We expect that there will be an association between a low activity profile near retirement and an increased observation of osteoporosis during post-retirement. We believe this because a low activity profile decreases bone mineral density by approximately 0.4% a month. In doing this study, we wish to contribute to the existing knowledge of osteoporosis. We will determine which levels of frequency, intensity, and duration of an activity profile are associated with osteoporosis. With this information, we will increase awareness of an appropriate activity profile in adulthood in preventing the osteoporotic condition among the general population, healthcare professionals, and government agencies. Osteoporosis is a disease that is characterized by low bone mass and deterioration of bone tissue, leading to enhanced bone fragility and an increase in fracture risk. It is important to emphasize that fractures experienced from osteoporosis are extremely painful and can result in disfigurement, decreased independence, mortality, and loss of mobility. Osteoporosis is commonly referred to as the silent thief because there are no symptoms until a fracture occurs. Unfortunately, there are no cures available for osteoporosis. Once bone mass is lost, it is hard, if not impossible, to regain. When comparing the bone structures of a healthy bone and an osteoporotic bone, you can see how the osteoporotic bone would be more prone to fracture due to the decrease in bone density. It is estimated that 1 out of 4 women over the age of 50 in Canada have osteoporosis. Along with this, it is important to emphasize that a significant portion from this population is sedentary. 58.7% of women ages 50 and older are physically inactive. Being physically inactive is a modifiable risk factor of osteoporosis that has a direct effect on bone mass. When we are moving, our muscles contract and pull on our bones. This stresses bone tissue in a way that causes an increase in bone density. Vertebral fractures experienced from osteoporosis can result in back pain, height loss, and kyphosis, which is an abnormal curve in the spine. Because the rib cage pushes on the stomach, kyphosis can cause constipation, abdominal pain, reduced appetite, and premature satiety. Suffering from a hip fracture significantly increases mortality rates after the fracture, and many are permanently disabled and will be in a long-term care facility for at least a year. To no surprise, people with osteoporosis struggle with the pain, physical limitations, and lifestyle changes that follow the fracture. Not only is this disease affecting the quality of life for women, but it also has financial impact on the healthcare system. The overall annual cost to the Canadian healthcare system of treating osteoporosis and the fractures it causes was over $2.3 billion as of 2010. Considering the devastating effects of this disease, it is important that we investigate a possible association between the diagnosis of the osteoporotic condition and an activity profile. If an association exists, society will have the data required to take appropriate action, such as creating prevention programs to increase the activity profile of postmenopausal women. To illustrate the importance of our study to an even greater extent, Dottie and her husband will share their experience with osteoporosis.
I thought I was coming down with just a bad cold, and I just started coughing, and I coughed so hard that I almost fell to the floor, and I could feel a severe pain in my lower back. We went to the ER, and they did an MRI and found out that I had a fracture of L4. So I had surgery on that and followed up with an orthopedic doctor, and he indicated that I had osteoporosis because he said there's just no way that I could fracture a vertebrae by coughing if I didn't have osteoporosis. And also, once they got in and saw my bones, they could see how soft they were. I don't think people really realize how bad osteoporosis is because it is such a silent disease until they actually get it themselves.
But it changes your family so much that grandkids used to love to come and run to grandma and hug her, but first time that they came, I says, you can't do that. You gotta just touch grandma very softly because you can't squeeze her.
Characteristics of our population include retired postmenopausal women from Prince Edward Island between the ages of 55 and 65. Our participants may come from sources such as Curves, Weight Watchers, and UPEI's alumni. We will recruit our participants through advertisements on Compass and on posters through a QR code. This will direct our participants to our website. We will also offer an incentive of a $100 gift card from the Superstore in exchange for their participation. At this time, please scan our QR code if you are able to do so. This will take you directly to our website. For those of you who were unable to scan the code, here's what our website looks like. Our research design is a cross-sectional study. We are using a retrospective approach which will be explained further in our presentation. To be 95% confident, we will use 700 study participants. The independent variable in our study is the activity profile of our participants. This will be measured through an online activity profile questionnaire. The activity profile questionnaire is comprised of 3 categories, which are sedentary behaviors, physical activity behaviors, and exercise behaviors. Sedentary behaviors are when you are being inactive, such as watching television. Physical activity behaviors are completing physical activity during your daily duties, such as gardening. Exercise behaviors are completing activity with the intention of improving health, such as walking for pleasure. The activity profile questionnaire will be retrospective, as the participants will be asked to base their answers on 5 years prior to their retirement. As you briefly saw on our website, this is the questionnaire that we will use to assess our participants. The dependent variable in our study is the observation of the osteoporotic condition. More specifically, determining which participants are at an increased risk of developing osteoporosis or whether or not the participant even has osteoporosis. This will be measured through the bone density of each participant. To measure bone density, each participant will undergo a dual energy X-ray absorptometry procedure. The dual energy X-ray absorptometry procedure is simple and painless and only requires 15 to 30 minutes to complete. It is completed by a radiographer and is the most accurate tool for measuring bone density. It will generate a T-score, which is a comparison of an individual's bone density to the average peak of bone density of a 30-year-old healthy adult. The T-score of the participants will then be evaluated using the following standards. As you can see, the T-score will show us if a participant has healthy bones, an increased risk for fracture, or is positive for osteoporosis. This equation shows the relationship between the osteoporosis T-score and the correlation with the responses received from the retrospective activity profile questionnaire. In our study, we realized that there are limitations. For instance, PEI is mainly rural, so this would have impacts on people's means of transportation for work. we would see that more people would be driving to work as opposed to walking. Our participants are only retired women, so we are excluding women who do not have gainful employment from which to retire from. There are other risk factors associated with osteoporosis. However, we have recorded other possible risk factors during the registration of our participants and will take this into consideration during data analysis.